Hey everybody, welcome. We're just going to get started here in a second. Looks like we're stabilizing on our numbers. So excited for today. And this is our first time trying this cycle at noon. So super excited if you guys can give on your feedback some thoughts about how that works for you. We're really trying to respect people's wellness. And this is our first time where we're trying to build this into the noon cycle for these kind of webinars. So welcome everybody. This is our first webinar for the concussion overview and update. This will be a three-part series that is hosted by the Office of Lifelong Learning Physician Learning Program here at the University of Alberta. My name is Denise Campbell-Share. I'm a family doctor here in Edmonton and the Associate Dean of the Office of Lifelong Learning Physician Learning Program. Our office is committed to providing reliable updates and resources for clinicians, researchers, and everyone committed to addressing challenges related to concussion. And we're so excited for this series and so delighted to welcome today Dr. Jennifer Dawson and Stephanie Cowle, who will be sharing with us updates on the Living Guideline for Pediatric Concussion, as well as efforts to address prevention, recognition, and management of concussion as a coordinated approach. So Stephanie Cowle has spent 14 years in the area of injury and trauma prevention. She's the director of knowledge translation at Parachute. Parachute is a national charity focused on preventing serious and fatal injuries through evidence-based solutions. Stephanie leads Parachute's work to improve concussion prevention, recognition, and management across Canada, including the publication of the first ever Canadian guideline on concussion in sport. Stephanie's worked with more than 50 national sport bodies, as well as government, health, and education stakeholders at national and provincial levels. She's a member of the Federal Provincial Territorial Working Group on Concussion in Sport and the Knowledge Translation Coordinator for the Canadian Concussion Network, le Réseau Canadien des Commotions. Jennifer is joining us from Cowle in Ottawa. Jennifer has a PhD in cellular and molecular medicine and a master's in pharmacology and toxicology. And as the guideline developer for the Living Guidelines for Pediatric Concussion Care, Jennifer works with concussion experts from Canada and the US to synthesize and review all new research findings pertaining to pediatric concussion care, and to ensure that all recommendations and tools within the Living Guideline are up to date and reflect expert consensus. So delighted to welcome you both, Jennifer and Stephanie. And I think we're going to turn it over to Jennifer to kick us off. I'm going to mute myself. I got to figure out how to do that. Okay.
Thanks very much. It looks like I need to stop sharing your screen, and I think I can share mine. I'm very pleased to be here today to share some updates from our project and get to know a few of the medical community members in Alberta. As mentioned, I work out of Ottawa at Cowle. My main role is the developer of the Living Guideline. And this has been a really exciting role because concussion care has changed quite dramatically, even over the past 3 years. And these changes mean that we're actually able to help kids and adults, but in my case, I mostly focus on the adult child population, actually get back to things they enjoy safely and also reduce a prolonged recovery. So first of all, I'll go through my disclosures. This project is actually funded by the Ministry of Ontario. However, our expert panel is made up of actually not even the majority of people are from Ontario. There are numerous experts from Alberta and also from across North America. In addition to the work I do at Cowle, I also do some collaborations with the folks at Interdisciplinary Clinic 360 Concussion Care as part of my disclosures. The learning objectives today are first, you should be able to describe this project, and hopefully when you leave today, you'll have a chance to check it out yourself and see if you can download some of the tools that will be able to help you in your practice. The most important update is for you to be aware of some of these changes, and hopefully that will also make you aware of them when you're seeing people coming into your clinics and be able to help children recover faster from concussion. So the PEDS Concussion Project, the Living Guideline for Pediatric Concussion Care, is housed on a website. We do have a stationary PDF version, but I do suggest if you're sharing this with your colleagues that you refer them directly back to the website, because the tools and resources within this project change very regularly based on new evidence in the literature. What our team does is we look at new papers, we review them, and decide when the threshold has been met that evidence should actually change clinical practice. And the nice thing about our model is we can do this fairly efficiently. So anything that you see live on this website is up to date within the last 6 months to a year. And hopefully you will notice some changes in this presentation from some of the previous versions and clinical standard guidelines that are shared. There's different components to our website. We have the web-based version, as I mentioned. We also have an up-to-date post-concussion information sheet, which is a great resource for both clinicians and patients to summarize a lot of these recommendations in a fairly lay summary way. We also have updated return to school and activity protocols, and these all reflect 2022 guidance, which is very different actually from the 2017 versions. In addition, we have a new Living Guideline evidence map, which I won't focus on today, but if you are interested in checking out some of the evidence that supports these clinical changes, this map is an interactive tool where you can pull the references, read the abstracts, and share them with your colleagues if you're looking, for example, to do a literature review or want to read the studies yourself. And finally, we do have a downloadable PDF. The guideline itself is broken down into 3 sections that house 15 domains. The first section focuses on recognition and directing to care. So we're talking about the person out on the sports field who hits their head. What are the next steps to get that person off the field and seeking the appropriate care? We then have a domain on initial management and assessment, medical follow-up and prolonged concussion, medical clearance for full contact sport. There are also some sport concussion considerations, including a recommendation on baseline testing, return to school and work protocols. And finally, there's a new module on telemedicine and virtual concussion care. And there's actually a manual to help clinicians who may need to see a patient remotely be able to work through some of these assessment tools virtually. The second and third sections focus first on individual symptoms and managing them. And we do have clinical algorithms for most of these, headache, sleep, mental health, vision, vestibular and oculomotor function, for example. And finally, we have a third section that shares information on emerging technologies. At the moment, we don't have any neurological or serologic blood biomarkers that we can use to either diagnose or identify or even monitor recovery for concussion. However, because of the vast amount of research that is going on, we monitor this very closely in order to see when that threshold will be met and when these tools may be useful in the clinics. So at the moment, as I mentioned, we have recommendations, but none of them are for clinical use at this time. So what is this project? My main supervisor is Dr. Roger Zemek at CHIO, and he started this guideline in 2014, recognizing the need for pediatric-specific clinical recommendations. The second edition was when I was brought on the team in 2018, and we published the second edition, and at the same time realized that we can't wait 4 or 5 years to update these recommendations. Evidence was coming out so quickly that we realized we needed to be able to update faster, and the evidence was exciting. It means that kids can actually get better at a faster rate and reduce the risk of prolonged recovery. So we feel that this was a great idea. The project itself is large. This was a pretty fun slide to make. It's just a snippet of some of those 45 experts, all of whom vote on all of the major updates. So we need to have 75% of these experts vote for any major recommendation change on the guideline. There are, I think, 47 experts at this time from various institutions across North America, as I mentioned. And the nice thing about this is if you were to glance at these logos, you'll see that it truly is an interdisciplinary team. And so we have different viewpoints from across disciplines who are coming together to really make sure that we get this right and that our guidelines are based on the most current evidence and expert opinion. So if you're interested, here's a quick QR code for those that are, technologically advanced and want to hold their phones up. I encourage you to check out the website. Hopefully you'll find some tools that you can use in your clinical practice. Now let's get to the exciting stuff. As I mentioned, the updates that have happened in the past really 1 to 2 years are major. We've gone from encouraging people to rest until they feel better to actually doing the opposite. Now, we're not telling them to get back out there on the sports field with a ball, but we are encouraging people to resume activity and even prescribing activity as early as 1 to 2 days after the accident in order to help improve recovery. We also have major updates to the return to school protocol just this past year. Another update that's important is knowing who and when to refer to an interdisciplinary or specialized care at that very first appointment when you see your patient and diagnose them with a concussion. The role of mental health in concussion likely isn't a surprise. However, it's really important, once again, to catch this early, and latest research has really highlighted the importance of managing and treating mental health early in the recovery process of concussion. And finally, everyone wants to know about screens and concussion. Is it going to give me brain damage? We have an update about that, and I'll work through some of these now. And I suppose we're probably going to take questions at the end. If you have the ability to and wish to interrupt me, I don't mind. Feel free, or we can save questions, and also after Steph presents her update, we can have questions then. So I guess this is probably a question you know the answer to now. How important and what role is rest? Does rest have on recovery from concussion? We all know that up pre-2017, we thought it was really important that people rested at home, sometimes in a dark room, until they felt better after a brain injury. We were scared that things would get worse, that they could even have a more serious injury by overdoing it after a concussion. We now know that yes, rest has a place. However, that rest should not be more than 1 to 2 days after a concussion, complete rest. And returning to safe physical exercise is actually medicine, and we are finding that it can help improve recovery. This is a neat picture. This is a picture taken of Dr. John Letty, and he is the lead researcher in what's called the Buffalo Concussion Test. This can be done using a treadmill, using stationary bikes, and they're also developing some marching in place protocols that haven't been published but are coming through the pipeline to allow specialists to actually find a threshold of prescribed aerobic exercise. And there has been numerous recent studies, starting in 2016, when they found the association between early physical exercise and a reduction in post-concussive symptoms, to more recent randomized controlled trials using this Buffalo concussion test as prescribed subthreshold aerobic exercise. And so they found that as long as you're not putting the person at risk of falling or getting hit in the head or, and having another injury, increasing the heart rate can actually help improve recovery. And we really need to be encouraging these people to start moving slowly and gradually, but keep on that trajectory and not go back to the complete rest that we once prescribed really only less than 5 years ago. And finally, our team at CHIO, I wasn't on the study, but many of my colleagues were, also did an even more recent study on pediatrics, looking to see in terms of safety and also effectiveness of this prescribed exercise. This study was done at the 72-hour mark post-acute injury. Most of the recommendations actually extend that it's been safe within 48 hours. And the current recommendation is actually to resume light aerobic exercise within 1 to 2 days. So 24 to 48 hours, we want to get the patients moving. If they're already quite active before their injury, that may even include a jog. Others, it may be a walk around the block. But we don't want to see them go back to what we nickname bedroom jail, waiting around until they feel better. Of course, with this, we never want to be sending kids back to the game or in any environment where they could have an injury. So in summary, we found that complete rest for more than 2 days may actually slow recovery, and it's no longer recommended. So these low-risk exercises, depending on the individual, can actually, as long as it's increasing the heart rate, we found that it's beneficial, and our experts have decided that is a very strong recommendation for all patients across the board. Always remembering to avoid any high-risk activity, and remembering that medical clearance is still required before anyone goes back in the game or they return to any high-risk sport, physical activity, or competitive environment. So on our website, we share this updated protocol. So this is updated to 2022 evidence, where at step 2, so the first step is immediately after that injury, complete rest for a maximum of 1 to 2 days, moving through a graduated increase in aerobic and also skill-specific exercises, avoiding anything that you could get a hit. For full contact activities, that's when you need medical clearance to return to step 5 and 6. So these 2 steps are very similar to the previous recommendations. The second guideline update is actually very interesting. Evidence has been a little bit slower to figure out the exact time when we should be sending children back into the school environment. Before this paper just came out in 2023, just in 2022, our experts were concerned. They were saying, we can't have kids waiting at home until they feel better and not returning to the school environment. We know it's important to get these people back and at least starting to engage with their friends, doing light homework. Roger Zemek likes to joke, homework doesn't cause brain damage. It's okay if they feel a little bit worse. We want them to gradually start increasing their tolerance and managing workloads, and they can take a break if needed. And so the recommendation was made by the experts on the guideline that the return to partial day school should begin as early as possible, and a maximum of 7 days. So within 7 days, they want that child to be at least partially back with accommodations so they can tolerate their symptoms in the school environment. And in 2023, I won't spend too much time on the research because I'd really like to give Steph a nice chance to present their work with Parachute. But they're starting to find that that early return to school is associated as well with an improvement in recovery at 2 weeks post-injury. So I won't go through the steps of return to school. It's fairly similar to return to activity, but once again, within 1 to 2 days, we really need to be encouraging patients. And so that means that these types of protocols, after you diagnose a patient, this person should have this in their hand and they should understand that they shouldn't be waiting at home and coming back 2 weeks later and saying, I'm not any better yet, or things aren't improving. They should be taking an active role. And in a few minutes, I'll talk about referrals for those that may not be improving right away. But by all means, everyone should have this information, know what is safe, what is suggested, and also what to avoid to not experience another injury. Mental health and the role of concussion is strong. You've likely seen a lot in the news and in medical publications. Emotional changes are common. And the evidence leads that early interventions are really, really key. So referring youth to an interdisciplinary team, including those mental health specialists, is crucial. There was another paper that will be actually solidifying these recommendations, and I won't go through the details, but there really appears to be a link between mental health problems and concussion, and it's something we need to be aware of on a regular basis when helping to manage concussion. In the guideline, we have our main tool, which is manage acute and prolonged concussion symptoms. And there's about 8 other algorithms. This is the one we try to be all encompassing, where we're referring out for mental health. So basically, after diagnosing a concussion, if the person isn't improving, they do need to be referred to a specialist, and they should be coming back to the doctor within a week to have that checkup and making sure that they return to school, they're starting to do things they enjoy, interacting with their friends and family members, and starting to do some light work, homework as well. to get back into things. So I encourage you to check out this tool as well. The fourth tip is that referral. That update also is from 2022, and we've realized that kids that are referred early to get that supportive care do much better and have a much lower risk of a prolonged recovery. And the actual study that supports this recommendation is getting them in within 8 days. There's a risk score calculator, which was published in JAMA in 2016. And there's actually a tool, it's called the 5P tool, that you can work through. And we have that in our guideline recommendations as well. And it will highlight which children are at risk for a prolonged recovery. Risk factors vary, but include history of migraines, adolescent females, those with previous prolonged recoveries, different levels of symptoms. So I encourage you to review that as well. So the tool is called 5pconcussion.com. That's the score calculator. Anyone who is at higher risk of a delayed recovery should be immediately referred to one of those interdisciplinary teams that is supervised by an MD. Also, everyone not improving after 2 to 4 weeks also really needs to be referred. If we wait too long, it doesn't seem to help get them better. And finally, athletes, and this is the new recommendation in the guideline, and anyone active would greatly benefit from an immediate referral to get that Buffalo concussion test done, to try to optimize their return with a prescription for aerobic exercise. Finally, the one we've all been waiting for, what about screen devices? Should we be telling people to completely avoid their cell phones? Is that even possible in this day and age? The evidence is still emerging, but we do suggest that screen devices be avoided for that first 1 to 2 days of rest. After that time, similar to returning to school and other activities we enjoy, it's okay to start integrating these devices and the use of them back into our lifestyles if you can tolerate the symptoms. So if you have a patient who symptoms get much worse and can't be tolerated from that screen time, then that is an indication that that is probably not an activity you want to return to right away. Perhaps they can try other cognitive tasks and also in parallel with exercise to improve their recovery. For that reason, we need to also make sure that parents and the child themselves understands to speak with their school and start to get early accommodations, because this can greatly affect a child in their school environment, especially teenagers who will be doing a lot of their work at school on screens. So in summary, concussion is common. We're seeing it a lot, and because of the change in recommendations, we also see that there are some gaps, and people are getting a little bit confused about how much to rest, how much to exercise, what should be avoided. So we really hope by doing these types of presentations, collaborating with our experts, and collaborating with amazing knowledge brokers such as Parachute, that we can spread these new updates and people can start to benefit from these findings. I strongly suggest you keep the 5P rule in your back pocket to try to help identify those kids who are at risk. Referring those high risks really does help. And hopefully we can start to prevent the number of people coming back with a prolonged recovery. Really encouraging people to stay active, even after 1 to 2 days of rest, is important. I know we're trying to do that in many different aspects of medicine. And this is one where really the evidence is saying that it actually helps our brain heal. So it's important that people start those low risk activities to help them feel better. The importance of school, I've spoken about quite a bit. And with those referrals comes the need for physiotherapy to address balance or vestibular challenges. Also, the importance of screening for mental health and referring to counseling. So here's the guideline link below. And finally, I'll just pull that QR code up. I encourage you to check out the tools. We also share the Parachute resources on our website. And as I mentioned, if you have any questions at all, feel free to ask them at the end of this presentation or in the chat. Or you can also, we have some contact information on our website where if you'd like to get involved, we'd love to hear from you. So, thank you.
Thanks so much, Jennifer. Sorry guys, I was discombobulated at the beginning of the webinar, and so I totally forgot to highlight some of the items. But if you have a question for Jennifer, just pop it in the Q&A feature of the webinar. And we can't guarantee we're going to have time to cover all of them, because we definitely want to pivot to Stephanie, but we will capture those questions, and we will be sending out a Pearls document with a bunch of these resources together with the recordings. So Stephanie, let's turn it over to you.
Wonderful, thank you, and thanks, Jenny. Always love hearing your updates. I've heard Jenny more than once, and it never gets old. And I'm hoping to be relatively brief here, enough to share the information I think you'd be most interested in, but hoping to be brief so that we can get to some of that Q&A, because I think that's a really important component of our learning. So, Jenny's done a great job of highlighting the way that evidence is evolving and the importance of communicating that evidence to healthcare professionals and sharing implications for practice. And so I'm going to talk a little bit about what we're also doing to share this information broader in the community. And that does have implications for how this comes back on the healthcare system. So I'm going to kind of take us down a little path and then wrap us back around to what it means for you as physicians. Our organization, Parachute, it's already been mentioned, but we are Canada's national charity dedicated to injury prevention. Concussion is one of our priority focus areas. We focus on other leading causes of serious and fatal injury in Canada. So things like motor vehicle crashes, poisoning, and of course, fall prevention. So if those are topics of interest in your practice, we also have lots of information on that on our website, parachute.ca, and love to work with professionals across the country in these areas. I have nothing to disclose in relation to the work I'm speaking to today. And again, a quick recap of the learning objectives for this portion of the session. This information will help you understand efforts that are happening to improve concussion awareness and recognition in various settings in the community setting. So how this is impacting the public and potentially patients you might see, and talk about what this does mean for you as a physician. And point to additional resources, of course, that complement what Jenny's already described. And you'll hear us both refer back and forth with each other in these presentations, because we do think it is so important that different groups putting out messaging and resources in this area do collaborate to reduce duplication and reduce confusion. So our whole goal is that collaborative approach and trying to have a consistent approach across the country and across different audiences. I also do want to mention that Parachute is a national organization, but the way that we're able to do our work is really through collaboration. And I do want to acknowledge that in Alberta, the Injury Prevention Center at the University of Alberta is our lead injury prevention partner in the province. So in terms of the work we wanted to do around mobilization and change was really to address some gaps we were seeing in public opinion research, in the literature, in feedback from stakeholders, and just kind of environmental scans, what was happening in the concussion space. And this is going back to about 2016, so just before the last concussion consensus was released. And what we were seeing is a lack of consistency in approach across the country, particularly in the amateur sports system. So whether you're in Ontario or Alberta, playing soccer, playing hockey, everyone's kind of trying to tackle the issue of concussion and not really a lot of guidance in how to do that and how to do that in an updated and evidence-based way. We are also seeing and continue to see actually limitations in knowledge and persistent misperceptions among the public in particularly, including parents and caregivers about concussion. We've also seen, outdated clinical practice. There, as Jenny mentioned, there's been some really important updates, even since 2017, and, the need to get information out and encourage practice change. and overall a need in this country for people to understand where to go for credible information, and to know that that could be more than one spot. It could be, where do you go for information, and how can we make sure that the information there is good and current and valuable and consistent. So speak a little bit to what we've done in these areas and what's ongoing, and you might witness now that you become aware of it. So one of the things that we've been doing since 2017 is focused on more consistent concussion policies and protocols across sport. And so in 2017, we did release a Canadian guideline on concussion in sport. So this is a non-clinical guideline, and it really kind of narrows in on the information that those in and around sport organizations, such as coaches, sport administrators, also health professionals that volunteer with sport organizations, what they might need to know a best practice approach to concussion. And this work was funded by the Public Health Agency of Canada, and we had a supportive partnership with Sport Canada. And through this work, we've worked with over 50 national sport organizations, almost every national sport organization in the country, to update their concussion protocols, and in some cases, create a concussion protocol for the very first time. Now, since that time, it's now become mandatory under Sport Canada's funding policy that these sports have concussion policies and protocols. So that's new since 2021. And one of the things we did through this work was create templates for concussion protocols and several implementation tools. So sample medical letters, sample education sheets, various things. And while we created these with national sport organizations, these are freely available on our website. They've been adopted by community level sport, by schools, by recreation programs and daycares and all sorts. So they really are generally applicable. And those, again, are freely available on our website to be used. We've also expanded our partnerships with sport to look at kind of varying needs around how we can improve education, change sport culture. One of these examples of these partnerships is with Special Olympics Canada, where we've created resources and including a video specifically for their athletes. How do we talk about concussion recognition with adult athletes with intellectual disabilities? And how do we take out some of our ableist language and make things really applicable to different audiences? So getting to create these specific and relevant tools has been really exciting. We've also, gone through many channels to create public awareness. And again, all of this is available to access and is free to use. Our website has a concussion injury topic page with kind of just essential basic first information that we'd like people to know about concussion. We have guides on various topics from return to school to return to work, and for different audiences, including parents and caregivers. And not everything is sport focused. We really do want to make sure that people know that concussion can happen in many different activities, especially for young children and older adults. We have a free concussion ed app. This is not a clinical tool. This is an informational and educational tool to get information about prevention and management, but people can also track their symptoms and how they're feeling to kind of keep a journal and have that information on hand when they do talk to their physician or other healthcare professionals. And a channel we've most recently started exploring is podcasting. We have a podcast aimed at parents and caregivers primarily called Popping the Bubble Wrap, on various injury prevention topics, and we do have our first episode on concussion. We talk with parents, and then we bring on an expert guest to, spoiler alert, on that episode, I'm the quote unquote expert, and was happy to be part of that conversation. It's also important to be aware that there's lots of free e-learning out there, again, that is evidence-based, and that we've worked with all of these groups to ensure that the messaging is consistent, and for example, the guidelines are referenced. So there is, nationally certified training for coaches through the Coaching Association of Canada. There is a massive open online course in English through the University of Calgary and in French through Laval University. And that is a moderated course open to anyone, again, free to take. It's been taken by thousands of people already. walking through all sorts of different kind of general multidisciplinary information about concussion. And also we have the concussion awareness training tool with modules for various audiences. There's going to be, I believe, another webinar in this series where Dr. Shalina Babul is going to talk about the CAT, but I did want to mention it here, particularly because there is a CME credited course for medical professionals with information particularly around assessment, diagnosis, and moving on to referral. And just to restate, it does refer back to those both pediatric and adult guidelines. So, this work that we're doing to raise awareness about concussion, to improve processes in various sectors, because, concussion is not just a sport issue, it's not just a health issue, it kind of touches all of these different systems and people in all aspects of their lives. What does this mean for what you might be seeing as a physician? Well, the graph on the slide right now is, I know it's small to see, but you can see the trend of the bars. This is representing visits to emergency departments and physician offices in Ontario up to 2013. So the data is a little older, but representing those visits in Ontario, and you can just see that curve. And really the thought is not that we're suddenly having this epidemic, we're having way more concussions. I think the point is that people are more aware, people are reporting, people are seeking medical care for concussion more than ever because they're more aware and more knowledgeable. And we think this is a good thing. And we've seen similar patterns in the United States following introduction of concussion legislation there, more awareness, more reporting. And we've seen, I think even further increase of this type of reporting and care seeking since in Ontario, there was an introduction of Canada's first concussion specific legislation. So while we are raising awareness and improving processes, making sure that athletes or students are removed from activity and seek care if there is a suspected concussion, this might mean you might be seeing more patients seeking care for concussion. There may be more requests for medical assessment and medical clearance, again, particularly in the context of those looking to return to sport and competitive and contact sport. And there be maybe more requests for documentation, because when we have protocols in place, whether it's in school or sports settings, there is going to be some documentation coming along with that in order to track processes and ensure particularly young people's safety. And this can seem overwhelming. Particularly, I want to acknowledge where we are right now with a lot of challenges in our health systems across the country. I want to really acknowledge that and the position I think all our healthcare professionals are in right now. But I think we can see a positive that awareness is being raised, that people are reporting and seeking appropriate care, and that we know that timely care is associated with improved recovery. And I would also say that we are better equipped than ever with evidence-based resources to provide to patients for you to review for your practice. And the examples Jenny gave of that accessible living guideline is just one example of that. A couple of things just to wrap up my portion here. One, I do want to mention again our website at parachute.ca. We do have a collection specifically for health professionals where we have gathered links to various resources, again, including the guidelines, including the e-learning that I mentioned. That is all linked there. Kind of suggested resources for you to access, including resources for your patients and for general information. And finally, I would be remiss if I didn't mention that in Calgary this June, the Canadian Concussion Network will be hosting its third annual meeting with presentations from researchers all across Canada and some great symposia and keynote speakers, more updates on research and best practice and knowledge translation in concussion. So if this is of interest, I wanted to share this information with you, and you can check out more information about the network if you're interested in being part of it. We certainly welcome everyone for whom concussion, anywhere on the spectrum of concussion, is of interest to join. So thanks very much.
Awesome. Thanks so much, Stephanie. That's fantastic. Really appreciate both of your presentations. So just to remind folks, if you want to pop some questions in the Q&A, just on the back channel here, we were trying to address the first excellent question that Lana had posed around the multi-D team scenario here in Edmonton. And Connie's going to speak a little bit to some of that in her presentation in the third webinar. But at the moment, if you are in Edmonton, you can refer to the sports med docs at the Glen Sather, provided it's not MBA or WCB related. And she'll talk more about the clinic that they're working to put together at the Glen Sather. I guess one related question, and actually Connie, you were going to comment too as well, I think in yours, around some of the strategies as well that family docs can put into their practice. Because one of the things that springs to head is not everybody on the call will necessarily be in a close driving distance to Edmonton. And so what kind of supports can we put in place to support family docs, working in different locations on being able to help incorporate some of these excellent points in their own practice, or maybe in their local primary care network. So I don't know, Jen, Stephanie, if that's a little bit off topic for you guys today, or maybe if that's something we'll take forward to the third webinar, but maybe if you had a thought on that, that would be great. Oh, you're on mute.
Sorry, I was just going to say, I'll let Stephanie go first. I was actually right in the middle of typing an answer to one of the other questions in the chat. So I'll let her go first so I can.
Okay, I was just going to say, you're probably better equipped to answer than I on that one.
And this is surrounding accessibility of the clinics. Is that, I caught a little bit of it. As I said, I was just sharing a PubMed article in the answered questions.
Don't worry, Jen. So so Connie Lebrun is one of our colleagues in family medicine, sports medicine here at the U of A. And so she's actually going to be a panelist with us on the third concussion session. Mm-hmm. So we were all Lana had posed this fantastic question in the Q&A around, what do we have for this inter-D team? And then also I was thinking, okay, and what if you live at a geographic distance away from that? Like, we have a big geography and lots of active kids. So how do we spread those best practices through primary care practice? And so for sure, Connie can take some of that in her remarks, but just didn't know if nationally, if you guys were aware of other strategies people might be putting out there for those of us with more of a generalist family practice.
Definitely, actually. And that was part of the motivation for developing the virtual care manual. That would allow a primary care clinician to start to work through some of the evaluations. We're not at the stage where we can conduct the Buffalo concussion test virtually, because there's quite a few different variables, including safety involved. However, many of the balance and the other deficits can be evaluated. There is strict criteria because, as you know, the first thing we need to do is rule out more severe injuries and make sure we're not missing something when diagnosing a concussion, or someone coming in with a severe mechanism of injury, for example. But there are quite a few tools. So I can share a link to that manual if you'd like in the chat. I think that another thing I was sharing, actually, which is part of the reason why I missed half the question, is I wanted to flag it that I work on the pediatric side, but there is an amazing team who are also based out of Ottawa that have just released, and I don't think they've actually splashily released it yet because they're still finalizing it. But they have an adult concussion guideline that they're pivoting to the living model. And along with that, some of their team members have developed standards for concussion clinics that are very useful, and those can be applied to different contexts. So for example, if you're in a geographically isolated area and you need to find an appropriate medical professional to help, you can work with some of those suggestions and try to find the best fit for what you need. So I think I've shared it. I think it's been hard because there's questions in the Q&A and there's questions in the chat, and I'm not sure if everyone is using both.
And this is my bad because I totally messed up on the housekeeping. Please actually post it in the Q&A because the chat actually none of the participants can see.
Oh dear. Okay.
The chat
well, I think I have been answering in the Q&A. Yeah. I just pasted it over the chat because I got a little bit confused.
Yeah. Awesome. My bad.
So if you refer to the question from Lana, her question came at 2:29. I think it was the very first question in the 4. You can see that I've shared their project, and I also encourage you to check out their recommendations because they've done a really nice job. Not all of them are finalized with the updates, but they have a very similar model to us, and I highly recommend that for tools for adults.
Yeah. And I think Connie will be speaking to that in her session later on in the series. And just if you could also post, you mentioned as well for more severe mechanisms of injury, like the workbook you mentioned, because Carrie has a question in the Q&A about what about if it's MVA or WCB related, and she's actually physically in Calgary. And Terry, I don't know that we have anybody on the call right now who knows the referral ecosystem in Calgary, but I think what Jen was just alluding to in terms of severity of mechanism of injury and some of those tools might be really helpful, just in terms of being able to navigate that.
Well, I think that when we see someone with a head injury, we treat them the same way, right? I'm not a clinician. I say we, but I help the experts write the recommendations, and we recommend every patient has to go through that differential diagnosis, and the very first step is to watch for red flags, where you'd be sending that person immediately to the emergency department, and likely they would need some scanning at the very least. So in terms of referrals after the fact, I guess that's where I wouldn't be able to answer because that's really a regional specific.
Yeah. Jennifer, actually, I wasn't asking. I was just actually going to go to tell Terry.
Sorry. Okay, good.
There's actually the specialty link here in Calgary, and I would suggest if you're, if you don't think it's emerge related, but you need some guidance about where to refer, that I would just go to specialty link in Calgary and Connect MD in Edmonton. But I know that we have a whole bunch of clinicians on the call, so if folks have other pearls for your colleagues, please go ahead and just pop them into the Q&A. I think that would be fantastic. And then Andrew, with regards to the adult concussion guidelines, Jennifer's just typing in there, and we're going to have some more sessions in this in the 3rd session, more about adults when Connie does her session as well. So I think we'll cover that item. So just while we're waiting, if other folks have more questions, I know people are getting ready to go back to clinic. Just as a little bit of housekeeping, in conjunction with today's webinar, so please, we're going to be sending out a Q&A or sort of evaluation form. Please do it because this is our first time trying to do one of these in a lunch hour. And I'm hoping that we look like really calm ducks on the surface, but I can tell you under the sea, our feet are going a million miles an hour. So thoughts, feedback from the group. Do you like this format? Do you like it in the morning? Would be super helpful. And the second piece of that is you will be getting an email that has the recording plus a pearls document. So all the wonderful things that Jennifer mentioned about the 5 Ps and the guidelines, you're going to have all that in the pearls document with links. The stuff with parachute, we'll put all those links in your pearls document. Hopefully that'll help people having to hunt around, just so that we can pull all that stuff into one place. Okay, other questions from folks as people are beavering back to clinic? So just with regards to credits then, again, in the email that you'll receive with the recording, there's going to be some orientation to the My Lifelong Learning Plan, which is a QI methodology that you can do that will give you some credits. And you can build that into your practice. It also works for your CPSA requirement for QA cycle. So if you're seeing a lot of kids with concussion, and if your practice, might be something where you'd really want to incorporate some of this more deliberately in a QI, that might be an awesome opportunity for you. You can also use that tool for any improvement that you want to undertake in your office and get credit for it. So I just encourage you to check that link out when you see it. It's free of charge. We created it in the office as a service to all of our colleagues. So love it if you could check that out and also give us some feedback on that as well. Okay, so Terry's question was addressed. There was a few more questions in the chat, specifically about this Buffalo concussion treadmill testing. And great advice around making sure that it's within scope of providers for if we're going to do that with the InterD team in our practice or in our PCNs. Awesome questions. An international audience as well today, which is like super cool. Okay, I think that's probably it. Did you guys have any other things that you wanted to chime in on, reflections that you've had about this process? What's the biggest change you've seen happen you said this all started in 2014. What kinds of impacts are you seeing? What's the biggest thing you've noticed so far?
Yeah, a couple of things. One, I think we are really expanding our understanding to how common concussion is, as Jen mentioned. I think when the spotlight really hit, it was really focused on hockey and football and boxing and perhaps military, particularly in the United States, and on male concussion. And I think we're just learning so much more about concussion much beyond sport, and learning more about age and other factors. And so it's been great to see that expand and knowledge gain. I mean, we've worked with lawn bowling, we've worked with badminton, we've worked, every single sport, because, returning to activity and safely removing people, your brain goes everywhere. It doesn't matter what kind of activity you're doing. So it's been nice to see that spread. There has been, lots of change in kind of policy and activity, but we do still have a way to go to getting people caught up. And so that's why events like this are so important. And I hope that there's been some learning gain today that might also lead to updated practice.
Cool. Well, it sounds like there's all kinds of recommendations in these guidelines that even in the big centers, we're not necessarily set up to implement. So awesome opportunity. Do you know, Jennifer, Stephanie, you had referred to one of the local agencies here that was instrumental with Parachute. Are you aware of any of the colleagues locally here in Calgary that might be beavering away on trying to set something up like that multi-clinic that you mentioned?
It's a good question about the multidisciplinary clinic. I'm not totally sure. I know that there's, the University of Calgary has a ton of work underway on, research. For example, they have their SHRED program where they are assessing high school aged students for concussion and studying, treatment and prevention and assessment and all sorts of great stuff. So University of Calgary is quite a hub for advancement in this area. So I think that's one place I might start in exploring what they're looking at in terms of systems of care.
Cool. That sounds like a great lead on a follow-up, because this problem's not going to be going anywhere totally rapidly. So we've got to amplify their work too. Jennifer, did you have any other pearls? Like, what's your big takeaway from all this work that you've been so engaged in? What do you see as the biggest change?
For me, I see it as a really positive change, in that we've gone from telling people to stay at home and whatever you do, don't make your symptoms worse, to actually allowing them to find things, perhaps not getting back into, soccer match, for safety, but there are many, many things, including even, pretty strenuous aerobic exercise that we now know can be safe, and not only is safe, but can actually help improve. And so I think there's a lot of hope because we can share that with people, and they no longer have to worry about, staying home and just waiting around. And also with that is hopefully moving towards reducing some of those mental health implications, which very likely in the next little while we'll see even more ties between mental health and staying home and being isolated as you recover. So for me, I think that's exciting. I'm fortunate that I've never had a concussion, but I think that it would be great to know that there are things you can do. It's not necessarily easy, and it can, it could be scary, but working through that and helping your recovery, I think, is a really positive thing.
Yeah. And if I can just layer one thing on that, Jen makes such a good point, because we're learning also a lot. We're shifting our language and the way we talk about concussion a bit, and we want to take it seriously, but we don't want to create extra anxiety and fear around it. So having very supportive discussions, the way that you interact with patients around this topic, focusing on the things that they can do, social support, working with parents to ensure that they're not creating necessarily extra anxiety unintentionally about missing school, missing things. We're learning so much more about that social and peer support, and kind of not fear mongering. So I think that's really important when we think about the way that we talk about concussion, write about concussion, assess, that we keep that in mind. I know that we have shifted a lot of our language to really think, okay, what message are we sending with this? Let's phrase in the positive, and really encourage people to recover in the best way possible, and whatever that looks like for them.
I just wanted to add in, I mean, this is actually Steph's field, so she knows it better than I do. But then along with that is also the continual reminder that we can't be putting them in any environment where they could risk another hit. And so we want to find that balance of not scaring them, but also keeping them safe, and, utilizing all of Parachute's amazing resources to keep them safe.
Can I just since there's no more clinical questions, I'm going to indulge myself with one for me. Just when you were talking about screens, are all screens taken equal? I don't do this video gaming thing, but my nieces and nephews do. And I mean, I was totally discombobulated just doing it once with all the twists and turns and all the things with the graphics. So are all screens taken equal, or are there certain things that are perhaps things that one should avoid, like that would be my wonder?
That's a good question, and we don't have the evidence yet to answer that. What we do know is that it's important that people are engaging in things that, for example, if a teenager, that's their only way to keep in touch with their friends, it would be worthwhile doing something to keep them engaged. And if your symptoms aren't getting a lot worse, so I mean, everyone has different symptoms, whether it be light, whether it be movement. So as far as I know from the literature, there's no clear answer. It's really individualized. And so communicating the need to stay active and engaged while at the same time tolerating and not severely worsening your symptoms, I think that has to be what drives those decisions.